Yumiko,
Yes.
this is Lori Rivera in Alamosa. I'm having a hard time getting onto the video call, so I'm not sure if it's a limited number for video or.
Hmm.
It
It shouldn't.
sorry, no, it shouldn't be. It's probably unfortunately a connectivity issue on your side. Sorry.
Okay, I'll keep trying, but I'm on the phone, so.
Okay, sorry about that. Yes, please keep trying. There shouldn't be any issues in terms of numbers on our end.
Okay, thank you.
Thank you.
I also know, unfortunately, if you're calling in from a county, when you're using your work computer, sometimes there's firewall things that block access to Google. So sometimes you can download like the Meet app on your phone. Not that you want to do that, but or like see if there's a way. There's like this sneaky incognito window you can use in your browser that might help too. How's
it going?
Yeah, we'll try to make this work for sure. This is a big group, and so this will be a fun exercise to see if we can do breakout groups and all the things we would want to do in person if we can figure out all a way to do the technology together. So, Joe, you want to take it away?
You bet, sure thing, Yumiko. Much obliged. Great to see everybody this morning. Sorry, it's been a week for us all for sure, but nevertheless, you did pick the right Friday meeting to join. This is going to be a lot of fun and a great exercise, and it's so wonderful to have so many folks from across the state join as we kick off our series of our Placement Continuum Learning Collaborative. So this is one of a series of collaboratives. There's going to be a lot of information about how to sign up for others if you aren't already. And today's conversation will be a deep dive into therapeutic and treatment foster homes. So we're just going to be doing a deep dive into those two very important lanes of work and types of placements that many folks probably have a lot of questions about. Also want to mention that as I'm speaking, as we're meeting right now, the Volume 7 rules related to building out therapeutic foster homes and allowing that reality in Colorado is going on right now. There's a presentation to State Board at a different virtual meeting for the State Board's consideration for rolling in rules related to therapeutic foster homes in Colorado. So super exciting. Who knows which meeting you should pick after I just said that, right? But we're glad you're here today. I want to give special thanks to Division of Child Welfare and Colorado Department of Human Services staff, Dennis Desperos and Amy Hickson, Kristen Melton and Trevor from our youth services team, Angelina Callis. So many strengths from Angelina, and she happens to be everywhere at once for sure. I want to thank Russo, Molly Bradley, and a special shout out to Yumiko Doherty, who has convened all these meetings and set the stage for us to be able to have these conversations. Thanks to everybody that's able to join, placement providers, county child welfare staff and administrators, child welfare division staff, and other community treatment and support providers. We are happy that you're here, and we want to hear from you about your great ideas and your bold visions. I want to also note before we dig into next steps that Colorado, there's been no other time in Colorado where there's been less children and youth in out-of-home care than today. We are seeing and maintaining the lowest numbers of out-of-home and congregate care that Colorado has ever seen. We've had a 27% decrease over the last 10 years in all types of placements. We have the highest numbers of placements with kin. So when that decision is made and when need to spend some time in another household, safety issues, greater chance to be placed with kin than ever before in Colorado's history. And we have seen a 66% decrease in congregate care over the last 10 years. 10 years ago, we had around 2,200 children and youth in congregate care. This month, we have 724. So amazing progress. And that's hats off to everybody on this call for making sure that whenever possible, kids are safe at home with their families in their communities. And the reason that we're here today is to build the future. So many groups have invested effort and conversations and commitments to outcomes on behalf of youth and children and families, incentives and performance. And we're so excited in next steps in implementing scientific and creative ways that we can offer solutions. How can we match a child or youth's unique gifts and needs to programs that are even more dynamic, responsive, and high value throughout Colorado? How can we redesign temporary out-of-home placements to be even more dynamic so that the placements move along our continuum, so that a young person's experience is seamless, and so that the connections they make with caring individuals, with you, aren't interrupted and even more meaningful as they heal? How can we continue to support the great work of our caring providers so that all of our creative ideas, everybody here, all of these ideas are supported in investments and policy? And how can we hold ourselves accountable to build out our placement continuum that can respond to the needs of any and all Coloradans across the state? So to do this, we need everybody's help. We need everybody's great ideas. We're going to spend this Friday sharing these ideas, and let's embark as we always do in partners. I think that's something that we do very well in Colorado. We bring folks together. We don't shy away from challenges, and we do our best to commit to solution-focused approach and supportive and engaging conversations with one another. Every worry that we have, every concern that we have, there's an opportunity buried within. We have totally open minds here, and we don't want to leave anything on the table. We don't want to gloss over any threats or any worries, but we want to engage with an idealized attitudes and our best thinking in support with one another. So I hope that we're all together. I hope that you're in with us. I hope that you are not shy in your comments and ideas, and we're so excited to dig in. We've got 153 folks on the call, and let's kick it off. Thanks, Yumiko, and take it away.
Awesome. Thank you so much, Joe, for that. And I don't even know if you introduced yourself, Joe, but everybody, that was Joe Homlar, our Director of Child Welfare at the state. So thanks so much, Joe. And yes, welcome everyone, all 153 of you and counting. We're so excited that this is our first kickoff meeting of our Placement Continuum Learning Collaboratives. My name is Yumiko Doherty. I am also at the state at CDHS and currently serving as the state's Chief Strategist for Family First. So I'll kind of be your MC here today as we go through this work together. So diving right in, we have a lot of ground to cover today. So this is meant to give you kind of a lay of the land and what the next couple hours are going to look like. I'm going to start by setting the vision. What is our vision for the future placement continuum in Colorado, as well as some important context for the discussion that we're going to have. And then we're really going to ground ourselves in a human-centered design approach to having these conversations. So we'll spend some time thinking about who are we designing the system for and what are their needs. And then we're going to hear from some panelists, some voices from the field who are actually engaging in some of this work already around treatment and therapeutic foster care, and hear their experiences as a way to spur ideas and innovative thinking. And then finally, we're going to spend hopefully a bulk of our time today in smaller breakout groups. And that's where we really want you to bring your ideas, bring your innovations, your perspectives, and have some of that interactive conversation to help us determine what the next steps are for really building this level of care in Colorado. So also want to mention up front, since we do want to leave as much time as possible for our breakout discussions, we have not planned to leave a lot of space in the first part of the meeting for open-ended Q&A. But I want to encourage you to use the chat feature in the room. So as questions and comments come to you, please feel free to write those in the chat. I have a number of wonderful team members with me on the call today, so they're going to help monitor things that are coming through the chat, and we'll respond to you in writing if it's feasible, and we'll do our best to get to your questions. So, but I do want you to know, again, that there's going to be plenty of room in the next couple hours for some of that more interactive discussion where you can get all your thoughts out. Okay? So first, diving into our vision. And all of our learning collaboratives are really in service of this vision here. So first of all, we want to right size our placement continuum to be more responsive to the needs of children and youth in care. And we're going to be hammering home that point today, that the first step is to truly understand the needs of our children and youth who are in care, and then design and build a system of services and supports around them. Second, and this is really very much mirrors the spirit and the intention of Family First, we want to ensure that when necessary for a child or youth to be placed out of home, that every child or youth placed out of home is in either a family-like setting or a short-term, high-quality, treatment-focused residential facility. And then finally, we want to ensure that all families have access to appropriate, responsive, effective services at every level of the continuum. So while these learning collaboratives were organized around different placement types, necessarily our conversations are very much going to move towards, but what are all those surrounding services and supports that need to be in place in order to make this continuum be responsive to the needs of children and youth? In terms of context, as I'm sure all of you are feeling, there is a lot happening all at the same time in Colorado. We have a number of large reforms that are all converging at the same time, that offer a lot of exciting opportunity for our system, but that are also having impact on the placement continuum. So of course, many of you are likely familiar with the Federal Family First Prevention Services Act, of which there's been lots of conversation and work on over the past couple of years. But also in Colorado, we've had sweeping child welfare reform passed over the last couple of years, as well as juvenile justice reform. There's a lot happening with our behavioral health system. And then also I added the Institutions of Mental Diseases, or the IMD issue, which is not in and of itself a reform, but these are all things that are coming together at the same time, again, to impact our placement continuum and really add some urgency and timeliness to the discussion that we're having here today. And so I'm going to attempt to give you a very oversimplified visual overview of how some of these reforms are impacting our placement continuum. So here again is a very simple picture of the current state of our placement continuum. So when a child or youth needs to be placed out of home, currently they can go in a family-like setting, so with kin, either non-certified or certified homes, and traditional foster families. Some children and youth go to congregate care settings. So currently that looks essentially like a group home, a group center, or a residential child care facility in RCCF. What Family First does is it says that the federal government will no longer reimburse or pay for certain congregate care levels. So in Colorado, group homes, group centers, and RCCFs, once we opt into Family First, we will no longer receive federal reimbursement for those placements. Family First, on the other hand, provides a lot of financial incentive and emphasis on the lower end of the continuum here, where there's a lot of focus on how can we keep children and youth at home with their families through the provision of prevention services. When children and families can't remain home, how do we ensure they're in a family-like setting? And when absolutely necessary, how do we ensure that if a child goes into a residential placement, it is for treatment purposes, it is high quality, and it's short term, right? So all of that really does mirror the state's vision for our placement continuum. On top of this, we have what we refer to as the IMD issue. And again, in very oversimplified terms, the impact of IMD is on our ability to get Medicaid reimbursement for the children and youth that are in residential levels of placement. And the ultimate impact of IMD is to essentially cap the capacity of those QRTP facilities. And so it's putting pressure on the number of beds that we can have at that level of care. So each facility can have no more than 16 beds at that highest level of QRTP care. which means that the challenge before us all today and in the coming months is to figure out how can we meet the needs of higher acuity children and youth who historically have often been placed in congregate care settings. How can we meet those needs at lower levels of care, in family-like settings or even at home? Here's a visual of how we envision the future placement continuum. Of course, all these learning collaboratives are, that the purpose is to build this out, right? And to refine what is the continuum that we want in the future. So this is where we're starting from, but this will likely evolve in the near future. Again, we want the continuum to be responsive to needs. We want robust community-based services at every level of this continuum. And you can see all that I've been talking about reflected here, right? That the continuum ranges from in-home prevention services all the way through those treatment-focused QRTP settings and others. And then there's a lot in between, which is what the learning collaboratives are really about in terms of refining and building out. For today's purpose, we're focused on the family-like setting column and diversifying our options at that level of care. So currently we have kinship homes, non-certified and certified, and we have traditional foster. But we want to build out that continuum at that level of care. So we have therapeutic and treatment foster and can meet a wider range of needs at that family-like setting. Okay, so that's what we're focusing on. As Joe mentioned, we have collaboratives that really touch on various points along the entire continuum. So as you can see here, we have collaboratives around that higher level QRTP care. We have one focused on traditional foster care. We have one that's very much focused on the impact of juvenile justice reform and the unique needs of that population. We're also going to be standing up a kinship group. And someone just mentioned yesterday, why isn't there an in-home services group? And absolutely, there needs to be that. So there will be more to come, but just know that for today, while we're focused on this one piece of the continuum, there are other collaboratives that are going to be looking at various other points. Okay, so real quick, just to do a little bit of level setting here, I'm not going to define some of these terms too rigidly, because again, the whole point of our discussion is think about these levels of care and what we want to build, right? But just in terms of giving us some orientation to these terms and some working definitions, wanted to spend a little bit of time here. So treatment foster care, basically what that means is that these are foster parents who have received specialized training and have enhanced supports and services to meet the complex needs of children and youth who would likely otherwise need to be in a residential setting. The primary purpose of placement in a treatment foster care setting is for treatment and is often done in conjunction with a mental health team. Therapeutic foster care, on the other hand, those children and youth also need some additional supports and services in the home. The primary purpose of the placement is not treatment. So if you think about it as a progression, we have traditional foster care homes, therapeutic, and then treatment as the most intensive on that spectrum. And then you can see that also reflected in current rules around these levels of care. So for example, in therapeutic foster care, the capacity or the maximum number of children in the home is 6, whereas with treatment, we cap it at 2. Okay, for therapeutic, we ask for an additional 12 hours of training for the foster parents above and beyond traditional. In treatment foster care, they need an additional 32 hours. Okay, so you can see how that progression works. Professional foster parents, I'm not going to attempt to define here. I throw that up there because to make the point that it can be defined many different ways. And we already know that that looks different in different states. And so when we're having conversations today, I encourage you, when we use terms like professional foster parents, that we take it a few layers down, okay? When we say that, what exactly is the need we're trying to meet? What are the various elements that we think are important when we say professional foster parents? Okay, so I put that up there because it's one of those terms that I've heard a lot in recent conversations, And we have a lot of work to do in Colorado to really spell out what exactly that means, as well as some other terms. Okay, so that concludes my big overview context section. And now we're going to move into this idea of taking a human-centered design approach to our conversations today. I love this quote because I think it really sums up what we're trying to do here. The people you're designing for are your roadmap for innovative solutions, okay? The people you're designing for are your roadmap. And so in human-centered design in general, what we're looking for is the intersection of desirability, the human aspect of design, viability, kind of the business aspect, and feasibility, all the various technical elements that need to go into an idea. And it's the intersection of those three things where you get your highest impact innovations. However, with each design project, you always start with desirability first, with the human piece first. And that's what we're going to be focusing all of our attention on today. And so I want you to know that absolutely we are going to have to talk about provider rates. We're going to have to talk about revisions to rule and all the other various technical pieces of this. We're just not going to talk about them today. We're going to focus on the children and youth that are in care in Colorado, what their needs are, and the system that we want to build to meet those needs. We want to dream, we want to think of the ideal and what's desirable. And that's it. That's what we want to focus on today. And to help us do that, many of our colleagues who Joe mentioned in the beginning have come up with these 6 use cases. And this is going to be the backbone of all our discussions today. You're going to each get to know at least one of these children or youth in your breakouts. These are fictional use cases that we created specifically for these conversations. They are reflective of current users of congregate care in Colorado today. They are by no means representative of an exhaustive list of all the various subpopulations, characteristics, experiences of children and youth in our system. But they are really helpful examples to guide our conversations. They represent historically some of the hardest to place youth in our system. They represent cases and experience that our providers have historically struggled to serve effectively. And so we intentionally chose cases that represent kind of the higher end of that spectrum in terms of needs and complexity. And that was intentional because in human-centered design, you want to design for that highest level on the continuum, because the hope is that we design solutions for this highest complex level, then we're going to be including everybody, right? We're going to cover the majority of other children and youth who enter our system and also have needs for care. And so that was intentional, and it's going to be challenging. But I also want, and the purpose too of picking the hardest cases or some of the hardest cases is that's what usually leads to creativity, right? It leads us to design and think of solutions that we may have never imagined if we were thinking about all the various youth that come into our system. And so when we go into breakout groups and you are assigned one of these youth and you learn more about him or her, I want us to challenge the notion that given a youth's background, experiences, and characteristics, that they belong in a certain level of care, like QRTP. We are setting up the possibility that each of these youth could and should be able to be served effectively in a family-like setting. Okay, and that is the challenge before us today. That's really the design challenge that we're working on, is how can the comprehensive needs of these 6 identified children and youth be met in family-based care? Before we get to that and dig in and get to know these use cases and have a lot of discussion, we are going to hear from a wonderful mix of panelists who are currently engaging in work at the therapeutic and the treatment level of care. So we have three panelists who are going to present and talk about some of their experiences at this level of care. And I encourage you to listen to their experiences with an open mind and think about what comes up for you in terms of what's needed at this level. What are some innovative ideas that their experiences are sparking in your mind that you want to carry over to the discussion that we're going to have soon? So our three panelists are Jenna and Kimberly from Safi of Colorado, and they're going to talk about their treatment foster care program. And then we're going to have Amber Biss from El Paso County and Lee Osterly from Kids Crossing, who will talk about a pilot they're doing around therapeutic foster care. And last but not least, we have two treatment foster parents who are going to share with us what it is like to be a treatment foster parent and bring it back to that real human-centered level. We will, now just glancing at the time, after each of these present some of their experience, we will have some time to engage with our panelists and do some Q&A. So be thinking if you have specific questions or things you want to engage with our panelists around. We will have time for at least a few questions, I'm hoping, to have some interactive discussion. And then just want to mention too, we have Mary Griffin and Lori Burney on the line who have a lot of experience at the state level with these levels of care. So I've asked them to join in the discussion as well for that kind of historical perspective in Colorado, as well as kind of what our other states are doing around this level of care. So with that, I am going to turn things over to Jenna and Kimberly from Safi to share with us. So Kim and Jenna, are you ready?
Hi, can you hear me?
Yes, we can hear you.
Okay, sorry, I have to use so I wanted to make sure you could hear both. So my name is Jenna Coleman. I'm the Executive Director of Safi of Colorado, and with me, my better half, I have Kimberly Sworn. She's our Treatment Director over Treatment Foster Care. So she's gonna go ahead and kick us off with talking about who we serve. Kim, you have to hit *6 to unmute. I think you also have to call in.
Okay, how about now? Can you guys hear me?
Yes.
Yes, okay, sorry about that. Yes, I am calling in too, so all the buttons, trying to figure out the technology, so thank you, Jenna. But thank you all for listening for a few minutes to hear about our treatment foster care program. Just a little background before jumping into who we serve. We have been providing treatment level services, foster care services at Safi for about 4 years. So it has definitely been a big learning curve and constantly changing. So we're excited to be able to kind of share some of our experience and hopefully some of our learning opportunities that we've learned throughout the 4 years as we support our community in developing more treatment foster homes. So in general, who we serve is we serve anybody, any youth ages of 3 to 18, and even a few youth in care who have opted to stay past their 18th birthday in a treatment foster home. So we don't have any specializations or certain criteria for placement. Outside of general, we are not mature or developmentally focused. So we really take it on a placement match of what our family dynamics look like and match them with, sorry, my computer just turned off. Match them with the youth that youth needs. Sorry, guys. Okay, Jenna, do you want to take lead for a minute while I get my computer back going? It just restarted.
Yep, no problem. So like Kim said, the kids that we predominantly see can be from 3 to 18. Our general age ranges are from 12 to 18. Typical symptomology that we see is pretty high-risk youth, right? So we see a lot of runaway, suicidal ideations, homicidal ideations, aggressive behavior, and even things like, you know, pretty high-risk things around like hygiene issues, toileting issues. So a lot of our kids are the ones that are typically more challenging to place. you want to jump to the next slide? Thank you.
And I got the screen back going, so I can jump in.
Okay, go for it.
So sorry, guys. So our model of care, we identified very trauma-focused and informed. It's a balance of research-based approaches and individualized care. Our recruitment, we do a lot of community recruitment, partnering with different agencies. Our family dynamics are very diverse, so we have a variety of different cultures and ethnicities in our homes. And then our large focus is on retention. Recruitment is big, but also retention, because it takes a lot of time, energy, and focus to bring on families and support them through the process that we do want to retain them as well. So we do put a lot of focus on events, self-care, kind of rewards, and highlighting some of their strengths in our foster parent community. I think the biggest difference that I think sets us aside for our model of care is our matching and placement process, is that we take a really intentional placement approach. We do not do any emergency cares within our TSC program. We spend a lot of time on pre-placement meetings to make sure that the families and the communities that they're in can support the youth needs, and then also develop plans and set up services prior to placement, along with pre-COVID, we used to require some visits and contact between the youth and foster families to support building a relationship. And we actually had one family that did family therapy with the youth in residential treatment for a few months prior to transitioning, which really eased that permanency claim for the youth. So that is kind of a nutshell of our model of care. What else? Can we go to the next slide? I think it just kind of spoke to that. We also, as part of the TFC, we have to provide 24/7 support for families. So we divide that up amongst all of our programs, our in-home family services and our foster care program, and provide eukaryotic de-escalation. So it's really focused on verbal de-escalation, recognizing the triggers, and then also how foster parents can seek safety in aggression without re-traumatizing youth. So we have master's level clinicians are when available to us, which is not always available, but if we have availability, we try and have a 2-person team approach with the families. So we found the best way to integrate that with the most consistency is actually master's level interns with neighboring and partnering universities. And that we found that to be very supportive of the families, so foster parents can get their support needs as well as the youth and skill building. Okay, some things that we have found that has worked well is really our intentional placement process. We have really positive feedback from foster parents of feeling prepared. Our support services have been rated on our surveys pretty high with foster families. We take a very individualized approach. Another thing about our model that really works well is our high team collaboration. We have a lot of communication with the whole treatment team and really integrate the whole treatment team before providing interventions or making any recommendations. So it's really a collaborative, full team community approach as much as possible. I spoke to the pre-placement visits. The other big thing I think that really works well is we have a really strong team culture within our agency. I think staff retention is really high on our priority list. And so we really try to reward employees for good behavior, where it's for their services and support. We have regular team meetings, team building activities, and of course this was kind of pre-COVID too, but we would do regular fun activities in the community. So really focusing on a strong team culture within our agency to help support through the intense trauma treatment that they are navigating individually with families. We also, I think, offering a lot of flexibility, whether that's through the direct interventions or through appointments, scheduling, team meetings. Flexibility and innovation, I think, is one of our high values that we integrate pretty effectively. And then kind of the creativity and intervention, that really trying to think outside of the box of what, taking a look at what has worked, what hasn't worked with families and youth, and supporting that in new creative ideas. So some of the challenges that we have faced is some foster parent dynamics, as far as, actually, let me just the respite availability. I think that's really important to highlight, is the respite is a lot of our families need regular recharge breaks. And I think probably everybody can relate to that as far as needing a break with this intense level of care. So we are trying really hard to establish a strong respite network within our agency. I think some of the barriers that we've had is when respite is not available, is partnering with different communities and agencies to find respite when a family needs it. Because we really found if we can integrate planned respite for families, that really helps preserve placements. Some community services is a challenge. We've had several placements over the years disrupt because of a lack of community supports that can help families. So in particular, what comes to mind is after school care and schools being trauma informed or trauma focused to work with the youth. For example, foster parents who both work full time, or you have a single foster parent who works, very challenging to work around some of those schedules and demands, so that we have had placements disrupt because of that. Building a foster parent support network. We have a very wide geographical location from Denver up until just a little north of Fort Collins. So not all of our foster parents are close. And I think actually that is one of the benefits of the COVID this year and telehealth, is that it's helped us jump into the virtual world to help bridge and unite some of the families together. But that is one of the feedbacks we have gotten over the years from foster parents, feeling isolated and alone. So we're really trying to tackle that. Clinician burnout. So a lot of individuals that apply for positions within SAPI are straight out of college. And I think some of that is just unfamiliar in the intensity of work. So burnout is high, and engaging in weekly crises with 12 families a week. So as far as what had we known then, what we know now. So one big thing that popped up in my brain was having an initial medication supply upon intake. And that's where we sort of reason for intentional placements was to make sure that we had that. We have a lot of youth who came from different placements and only had one or two medications. And then it took a couple of months to get into services with a psychiatrist upon placement. So one thing that we learned, which is kind of interesting, is to limit in-person support during crises. Sometimes that sounds counterproductive, but when we were providing more direct in-person supports, we found that that was disempowering the foster parent with the youth and bridging that gap and kind of hurting some of the relationships. So we really switched to focusing our interventions primarily with the foster parent as the agents of change to work through those crises. Some of the other kind of learning pieces is holding foster parents accountable for some of the foster care regulations along the way versus making changes kind of further down the line as people struggle with sudden changes. So the other thing recently, we primarily most of our homes only accept one youth, and that's not a standard. That is just with the intensity of our youth. Most of our families, that's what their emotional capacity is. We've had a few youth this year who have been open to second placements, and we are finding that there's even more intentionality needed prior to placement than even our standard. And that the emotional toll is even double what the one placement is. So we are still working through kind of what that means and what that looks like for families, but we have learned that is extremely tough on families with true TFC level youth. The other thing is, as we've been solely TFC levels up on kind of currently is that we started trying to dip our toes into traditional level placements, and we are exploring the therapeutic levels as we move forward and helping to build our foster parent network. We've had some kind of challenges and learning curves of how to define those different levels of care and make them more objective versus subjective, and then how in defining what those look like, and then how you move from those levels of care. So that is something we are still kind of working through and trying to figure out the best way to do that. And I think kind of we spoke on the geographical kind of limitations for our program. Okay, that was a lot of information kind of thrown out.
Great. Thank you so much, Kimberly. It was helpful to get an overview of kind of your model, as well as some of the things you've learned along the way. So thank you so much for that overview. I know it's a short amount of time to squeeze in a lot. So I'm going to move us along to our next presenters, Amber and Lee, who are doing some innovative things in El Paso County. So Amber and Lee, I'll turn it over to you now.
Thank you,
All right,
Yumi.
this is Lee. Testing. Can you hear me? Okay, good. When I first got on, I was concerned because it wouldn't let me turn my mic on. But it's working. Great. So this started in El Paso County back in December of 2017, when I had a meeting with Julie Crow shortly after she came to El Paso County from CDHS. She was the first one to tell me about Families First, and she talked to me about how congregate care was going to change, how group homes and group centers were not going to be viable under Families First, and also that the feds were going to allow for a 6-bed foster home. So out of that came the idea of transitioning family group homes to 6-bed foster homes. And that's how this pilot got started. So the first 3 homes that therapeutic foster homes, we weren't calling them that yet, but they were group homes that became 6-bed foster homes. The type of kids they took, we'll talk about, but that stayed the same. The programming stayed the same. The level of support stayed the same, and the rate stayed the same, so that they were able to continue to operate. The provider rate stayed the same for now instead of group home parents, they were now the foster parents. We have since licensed 2 homes that are new, that are 6-bed foster homes, one in Colorado Springs and one outside of La Junta. And that's been exciting and gone really well. So, Amber, did you want to talk from the county perspective?
Yeah, thank you. And I think what I would add is, so Lee mentioned meeting with Julie Crow, and she's our executive director, and where I sit as far as boots on the ground, working directly with our placement staff, we were really in El Paso County given full support to really collaborate and partner with Kids Crossing to figure out how to continue to make this work, and how to prioritize working with Kids Crossing to keep our El Paso County kids in our community. And so the support we had at my level and down from our leadership was huge in moving this forward. And so I would just really add that having that executive director support has allowed us to be where we are today with utilizing these 6-bed foster homes. Lee, do you want to talk about some of these bullet points around? I know it's similar to what Staffy had talked about, but you want to add to the what we see in these homes?
Sure. And before I do that, I do want to go back to mention that when we first came together, we worked with Rachel Klein at El Paso County, who's in contracts. Dennis Desperos was also involved from the state. And we developed contract language that was an addendum to the SS-23A that really defined what these homes were required, what was required of Kids Crossing in our oversight. That ended up being taken to the QRTP work group. Amy Hickson from CDHS took that and did a great job of and working with that group to come up with the rules that now I think are in the first reading later today, or maybe while we're here, I'm not sure, in terms of those rules. So as far as first thing I would say for traditional versus therapeutic is that traditional foster parents cannot rely on the income from foster care. They have to have other income, have to work outside the home, for example, where therapeutic foster care, we're allowing, again, with, again, a 6-bed foster home, we want to have a stay home foster parent or two. And, the rules are not restricting that in the same way, which kind of lends itself towards, the concept of professional foster parent, which I don't want to get into really yet either for this conversation. But one of the things that's gone really well is in terms of working with El Paso County, they have a placement team. And so we've worked it out in terms of we let them know when we have an opening coming up, as soon as that is. And most of our openings come about because of a successful discharge. We know 2, 4, 6 weeks ahead of time. We let them know, which allows them then to look for kids that are stepping down, for example, that's primarily what we work with in that. The therapeutic foster care rules talk about enhanced training. Yumiko, you mentioned that. The agency supports we offer is once a week home visits instead of once a month for a traditional foster home. We're a Medicaid agency, so we're able to provide therapy and in-home services to these homes for these kids. We found that to be very critical. And if we need some core funding, El Paso County's been good about that too. So I think we can go to the next slide. So the best way I think to talk about it kind of fits into this where it's in the continuum. These are kids that aren't making it in regular foster homes. And, one of the things I like about Families First is that with the qualified individual, the way this is going to work, we should be able to have kids at the appropriate higher level of care instead of them having to fail their way up into higher level of care by disrupting from so many foster homes before then they're placed in a residential program. These kids often have not made it in a regular foster home, or they're stepping down from a higher level of care. We work with a lot of delinquents. We have homes that work not entirely or exclusively with offense-specific youth, but we'll take 1, 2, or 3 of those kiddos at a time. Quite a few of our kids have some pretty severe mental health issues. Our Medicaid providers, our therapists, in-home workers, well, I'll start with our therapists, they're all trained in EMDR, they're all trained in trauma-focused cognitive behavioral therapy. We have a neurofeedback provider, and we are about a year into training staff and foster parents with trust-based relational interventions, TBRI. So that's an important part of our programming as well. These are not kids that need a permanent home. These are kids that have families that hopefully will go back to their families. But they may age out of the system and they've got a family, again, to go to at Thanksgiving or at Christmas. And so, we're working with these teens' families a lot. And so, what we're wanting is them to have the stability of being in a placement. There's very much of a milieu approach when you're talking, having 4 to 6 youth in a home. That's a very important part of any approach. And, what we're finding with the length of stay, it's kind of all over the place, but we do have kids that stay for a year in one of these homes. kind of a good news, bad news. It's good news that it provides that level of stability for youth in placement, but we then don't have a lot of openings over the course of a year. So we're working very hard with a marketing company. We do a lot of social media. We do a lot of print ads. We do billboards in Pueblo. And our recruitment efforts are exclusively for homes for teens. And so, I know I have kept mentioning 6-bed foster homes, which is what we did to transition the family group homes, and the 2 homes that we've started up are going to do 6 beds. But we have foster parents now who have been doing this for a long time, who are really good at what they do, get good outcomes, and we're looking at turning them into therapeutic foster homes, and they'll be what they've been doing, 2 to 4 homes. 2 to 4 kids in their home at a time.
Thank you. Thank you so much, Lee and Amber, for sharing about what you're doing in El Paso. I hope that, again, spurs some thinking and ideas in everyone to hear kind of how you've designed your approach. So thank you for sharing. And last but not least on our panel, I want to turn things over to Jess and Sydney, who are both serving as treatment foster parents in Denver County. So Jess and Sydney, take it away.
Awesome. Can you hear me all right?
Yes, you're a little quiet, Jess, but I can hear you.
Okay, I'll speak up. So my name is Jessica Kaimak, and I am actually a treatment foster parent in Denver County. I also have experience. I'm an LCSW and have worked with youth for about 10 years as a therapist. So come from it in that perspective as well. I was licensed and had my first kiddo back in August of 2019. And so about a year and a half have been taking kiddos, and I've had 2 placements. Each placement has been on their own. So 1 kiddo for 4 months, and then my last kiddo has come to me right at the end of February and is going on 9 or 10 months. But yeah, so I wanted to share just a little bit about our experience and kind of some of our needs, I think, as therapeutic foster homes. I would say when I signed up to be a foster parent, I actually didn't know I was getting into treatment foster care. And now it seems like a perfect fit, right? Like having clinical experience as a therapist and desire to be a foster parent, it kind of went hand in hand and has been a great experience overall. So I would say with Denver County, it is a newer program. And so all 3 of the homes that are currently accepting kids, we all were in the same like general foster care training together. And so we formed our own little network. So Sydney is also speaking, and then there's 1 other family as well. We all met each other in that training and were able to kind of create a nice network with each other, which I think is key to be a foster parent, right? To have somebody that can help with respite, but even also somebody that you can call when you're like needing advice or to vent or those sorts of things. So that has definitely been an amazing asset, and something I would say the county has said that they would try to connect us, and really something we had to take control on our own. And so I think as far as like planning for future connections, that I think that would be key. As far as some of the other things that all of you are talking about of needs for foster parents, I'm just going to echo that. I think respite options definitely are something that are needed and something that need to be specialized too, right? If our therapeutic foster homes are specialized to treat these kids, our respite options also need to be specialized. Talking about kind of the whole right, like having a career and being a treatment foster home has been difficult. So I can speak from my experience. My first kiddo, I was able to keep my job. And then my second kiddo, I did have to leave in order to really fully provide for her. And so I think that's something that, right, the awareness of the level that we have to provide for these kids sometimes gets in the way of a full-time job. Um, and I think there are things that could boost being those parents being able to keep that. I think one for me was having transportation for my kiddo. And then before and after school care, which is something I heard, right? And it has to be, again, kind of to that level of what the kid needs. So having level of care appropriate. Um, and I think one of the other things we were kind of chatting about is being very clear to the child about what a treatment foster home is. My 15-year-old, I think, could understand it. And I currently have a 10-year-old, and she's having a little bit harder understanding what that actually is. And so making sure caseworkers and therapists and all, like everybody that's involved is using the same messaging to kids about what a treatment foster home is and what the objective is. And so, yeah, I think that was something. I don't want to use up all the time. I want to make sure I give Sydney some time as well. I could go on and on, but Sydney, if you're ready.
Yeah. Hi, I hope you guys can hear me. I am Sydney Johnston. I have been doing therapeutic foster home for about the same time as Jess, as we were in the same class together. I came into this with quite a lot of experience with residential treatment facilities. I had about 15 years of experience in all levels. When I received my first kiddo, I was a principal at a residential treatment facility and found about 3 months in that it was impossible to maintain both. And so, similar to Jess, I have also left full-time positions and been really experimenting with very flexible and understanding part-time positions, creating some, I think Jess and I both have some of our own businesses going on. And, I've thought a lot about what would make this sustainable for me. I think, especially because I had lots of experience, I was thinking, oh, I'm used to 100 kids with high needs. One kid is going to be a breeze. And then quickly finding out that when you are providing, both Jess and I are single providers. And so providing 24-hour, 7 days a week in your home is quite different. And so there's been times where I have thought about if this is sustainable and if this is something I can continue. I would love it to be. I think I've thought a lot about what it would take. And I know you guys have mentioned kind of the professional foster homes, and I will speak on that in that the one thing that would make this a long-term possibility for me would be a reliable income. So yes, we do receive a daily rate that's higher than a regular foster care, and that's amazing. However, we only get those when the kids are with us. I have had some breaks in treatment where at the beginning of quarantine, I had a kiddo who was not following quarantine rules and running a lot. So he went to a treatment facility for a 2-week quarantine. But that meant that I missed out on half my month's payment, even though I was still doing the work of being a foster parent, still visiting, still, having phone calls and team meetings. There also, if sometimes when a child is on run, you may not get those placement or those rates. And so when I do get the rate and I have a stable child, I feel very safe and that this is sustainable. But when I have breaks in between placements, there was about a 3-month break that I had waiting for a client. And that, we have all talked about, we have to have savings. And I had to survive off of savings for 3 months until I got my kiddo. The other thing is that, and I think we all have mixed feelings about this. The payments are tax-free, which is really amazing. But there's been times where I don't have reportable income for purchasing a car or home loans. So that is something to that if it was considered an actual salary or a position, it would really help with my future plans. The other thing would be having benefits. I think that would be amazing because we were, I think Jess and I both had full-time jobs with benefits. And so when we left our full-time jobs, we also lost our benefits. There also is, I've had some experiences that have affected me very financially due to having a very high-risk child. One example is I did have a car stolen, and that it was driven by an underage kiddo to a different state, and my insurance did not cover that because it was a mechanical failure, probably due to a fact that an underage kiddo was driving in a snowstorm. But that has caused me to have to pay thousands of dollars out of pocket to cover that. That we also have experienced lots of property damage. So I really like the idea of maybe having some sort of reimbursement, maybe car insurance that is covered by the state. We are using our car a lot with the kid in it. And then I also echo everything that you guys said about respite, really having trained providers. We use each other as much as we can. I have had some experiences where I've used other foster parents and just who haven't had the training and experience, and there were some significant safety issues that arose out of that caused more damage than if I would have just, kept the kiddos at home. The other things that I thought about was just because this is a 24/7, highly engaging, we have to supervise overnight, the basic day-to-day tasks of being a parent, any help we could get with that, enhanced homemaking, having somebody to help clean the home or organize any sort of meal supports, having meals delivered, having groceries delivered. Instacart has saved my life over this past year and a half. So those are the things that I have thought about that would make this sustainable and long-term for me.
Thank you so much, Jess and Sydney, not only for serving as treatment foster parents, but for being willing to share and to give us some really honest, candid feedback and ideas to consider as we continue to build out this level of care. So thank you so much. And thank you to all of our panelists. I'm going to make a quick executive decision and say we're not going to open it up for Q&A, just looking up the time. I want to get you all in breakout sessions as soon as possible so that we can start digging in and actually designing this. However, I've seen several questions come through in the chat. So please know that we have all of your questions, and we can put you in touch with the panelists if you do want to follow up on anything, and we can help coordinate that for you. So thank you all so much. So let's talk about where we go next, which is having smaller group discussions around building out this level of care. Starting with another quote, right? Human-centered designers are persistently focused on what could be, not the countless obstacles that may get in the way. Constraints are inevitable, and often they push designers towards unexpected solutions. So I'm hoping you can all hold on to this because it's going to be very, very easy in these discussions to talk about all the challenges and the barriers and rates and everything else. And again, we really want to focus on dreaming big, creating what's desirable and what's ideal, and then later having conversations about how to make that a reality. Okay, so how this is going to work, Angelina is going to put all of us into random breakout sessions. So you're hopefully going to have a nice mix of people in your session that offer different perspectives. Each breakout group is going to be assigned one of those 6 use cases, and that's going to be the basis for your discussion. Your design challenge, again, is how can the comprehensive needs of your child or youth be met in a family-based setting? So basically what you're going to do, we're going to set you up with kind of a virtual whiteboard. And once you all read through your use case, you're going to have an opportunity to just brainstorm. right? As many ideas as you can. How can we meet this youth's needs? We're emphasizing creativity here over feasibility. Once you've got all your ideas out on Post-it notes, just as if you were together in a room in a big whiteboard, start moving things around, right? Finding themes, bundling things together, and then you're going to pick your top 3 ideas as a group. And then for the rest of the time, really work on building out those ideas to make them as full-fledged as you can, because those are the ideas then that we're going to continue taking forward to refine and prototype and try to turn into action over the next 4 months. So just to reiterate, when you get in your groups, Angelina is going to come into your room and post a link in your chat. Okay, so be a little patient. She's got to get to all the different rooms. When you get your link, click on it, and the first pages you're going to see are your use case. So take a few minutes to read through your use case. They're going to be several pages. They're very comprehensive. Oops, I'm being invited to a breakout group already.
Sorry, ignore that.
Okay, are we okay? Or did everyone?
I think folks might be going in.
Yeah. Okay, well,
yeah. Sorry,
you all,
I was trying to set the timer up and it hit okay, and then that was the end of it.
All right, well, you all that are still with us, so read through your use case and then click over in your Jamboard, okay, up here, and you're going to be able to use sticky notes to brainstorm and write all your various ideas. Move them around, look for themes, patterns, pick your top 3 ideas, and help us build those out. At the top of your breakout, there is a link to ask for help. So if you run into any technology issues, go ahead and push that link, and one of us will come in and help you out. And we'll also have floaters going into the various rooms. Ultimate goal, leave us with your top 3 ideas as fully fledged as you possibly can. And then the last 5-10 minutes will bring you all back to the main room to close out.